formula, elemental and disease specific. So what to choose and when to choose?
First of all, thank you Hexagon Nutrition Academy for doing such a very empirical session and very pertinent questions, Ipshitadi, that the choosing of these nutrition supplements is very important during this ICCU and other things, where Momitadi rightly pointed out about the semi-elemental formula, elemental formula and the standardized formula. So where we can say the polymeric formula for all the patients that we can give, but when there is a GI disturbances or the GI problem, or there is another cystic fibrosis in other patients also, we can directly go for the oligomeric formula or the monomeric formula, where the elemental and semi-elemental formula we can give, where the choosing of the nutritional supplements, where we can see the carbohydrate will be maximum the maltodextrin, because maltodextrin is something with the carbohydrate actually reduce any kind of malabsorptions, any kind of problem, or also the MCT, medium chain triglyceride, that is very easily absorbable fat that we can give for reduce any kind of inflammations and other things. But regarding the dietary fiber also, that we have to take care if the patients have the problem with the GI bleeding or GI trouble or the diarrhea problem, then regarding the dietary fiber also we have to take care. So choosing of the nutritional supplements, whether it will be a polymeric formula, whether it will be a oligomeric formula, or whether it will be a monomeric formula, that depends on the case specific. Where the SPN guideline says that you have to give the 1.2 to 1.5 gram protein per day. But Ipshitadi rightly pointed out about the HMB, like beta hydroxymethyl butyrate, but the mTOR, and the leucine is a very important amino acid, and whey protein also very easily digestible amino acid that we can give. But again, in the terms of the LCT and MCT, like standard formula, where the polymeric formula we can get the long chain triglyceride. So long chain triglyceride will directly not goes to directly the lumen for the absorption. But if we give it the medium chain triglyceride, 6 to 12 carbon triglyceride, that can easily absorbable. So depending on the case to case for the ICCU patients, we can decide about the different formula feeding.
Guide you to choice, choose the enteral nutrition formula regarding the protein content, fiber, other components like blood parameters and all.
Yes. So basically in the ICCU setups, we have to check all the blood parameters, because blood parameters is very important, because when the patient is going for a AKI patient or the CKD patient or the heart failure patients, or patients have the hyponatremia or the hypernatremia or hypokalemia, so the fluid balance is also has to be checked. So electrolytes has to be checked properly, like sodium, potassium, phosphorus, everything. And also for the hypokalemic patients, if we see there is a pot load is going on or injectable KCL is going on, then we can give some on top of any kind of formula that is a very good potassium content formula. Or if it is a hyponatremia patient, we can get a high good sodium amount of formula. Again, the fluid balance should be maintained properly. But again, on the top of what Momitadi said about the disease specific formula for the diabetic population, that we can give. But for the enteral nutrition patients who are like say the gastro patients, we can go for the semi-elemental form, and normal patients we can go for the any kind of polymeric formula. But regarding the dietary fiber, we have to be take care for giving and the checking of their stool, whether it's a diarrhea, whether it's a constipation, and accordingly we have to monitor about the nutrients of different formulas.
Here, first sisters will say, yes, stop the feeding. Because yes, always
NPM, they have to go for the NPM.
Absolutely, and all complaints and problems arise because of the dietitian's feed. They never check that new medicine has been introduced. Maybe patient was constipated, some laxative was, lactulose sort of a thing was introduced. So they won't check for those things. It is the formula feed, it is the product, whatever is being prescribed, that is the source of all trouble.
This is for the dietary supplement, patient
has started diarrhea. They will even, not sorry to say about sisters, clinicians also have that thought process.
That's exactly the same thing.
The first thing what you heard in your ICU, that if one patient is suffering from the diarrhea, इसको diarrhea है.
इसको NPM रखा है. इसको absolutely.
Problem with this
I think all of you have the same problem.
Diarrhea होने से everyone will report.
Nowadays it is less.
But you will never get a complaint that patient is getting constipated. They will never say. They go on feeling patient is bloated.
If the constipated patient, they will go for the DOs or enema. They are never depends on any kind of nutritional supplements.
30 years back it was more. They used to tag enteral feeds responsible for diarrhea.
Now my next question goes to Vijaya. My next question goes to Arithro. What are the key considerations for electrolyte management in critical care, like who are on nutritional support for renal impairment or AKI? CKD may be dialyzed, maybe non-dialyzed. So, how do you?
Because there are a lot of patients for the their AKI or ACKD patients, or there are some sepsis patients, or there are some heart failure patients already have said. So they have problem with that. They are taking on the positive inotropes. So for the positive inotropes like noradrenaline, norepinephrine, they are taking. So in that cases there is a problematic with some there are some fluid imbalances, and there is a fluid overload sometimes can occur. So in that cases we have to check that whether edema is there, whether ascites is there. So if there any kind of fluid restriction, the total fluid intake should be there, and accordingly we have to check their electrolyte balances like sodium, like potassium, like phosphorus and all things for the renal patients, and accordingly we have to wisely choose that what kind of supplement they has to take. So sometimes sister or doctor is to go for the Dab water, but again the concentrated Dab water, diluted Dab water does not make the potassium very rapidly. So in that cases we have to give on top of any kind of supplements that they can take for reduced hypokalemia. So in that cases we have to check again the fluid, again the urine output, whether it is a positive balance, whether it is a negative balance, and accordingly wisely we have to choose the supplements and we can give to the patients. But again, this could be very theoretical, but practically sometimes there is some tug of war is going on.
Thank you all our panelists. Now let us open the
patient, the AKI patient. So they are doing, sometimes the patient have a chronic diarrhea and they have a hypovolemia, so it is going on, and then said this is a CKD patient is there. So anything urea creatinine raised up doesn't mean the CKD. So they have to see these things.
You need to clinically correlate the results, and you need to do the bedside practices. Sitting in an office, you cannot run the show.
Even in the morning rounds, you can see that patients, so many blood workups have gone to the lab. So wait for the day, go again and check whether that blood test reports have come or not. If reports have come, please go through that reports and plan your plan of action should be decided accordingly.
In fact, you can pull up the doctors. Why you have not documented? Today only in the morning, in one of our ICU, patient had loose motion 4 times yesterday. Our doctor did not write in the file, and patient party was challenging us that the patient had loose motion yesterday. So I pulled up the doctor and told that why you have not documented it. Because it might be a medico-legal case if something goes wrong. So wherever you feel you are right, you need to fight for that.
And not only that, as per NABH and JCI, most of the hospitals these days are going for NABH because JCI is a very complicated thing. I think only Movitap is having that facility, no one else. So NABH is also saying if it is not documented, that means you have not done it. So whatever you see, whatever you go through, you have to document in your assessment. That only proves that you have seen it, you have checked it. So you have an ample scope to fight with the doctor also. I have checked it, I have seen it. That's why I have done it. It's our subject. Doctors only learn it for 3 hours in MBBS. So it is our subject. We have learned it for 7 years minimum. So we have to fight it out. So we have come a long way, but it's your turn. Thank you everyone. Already you have highlighted a part of it, how ingredients matter in choosing a formula.
Yes, definitely.
Because these days guidelines say that polymeric is the first line of treatment, line of prescription. but we need to focus on some other products also. So what's your take?
So definitely, what I have said already, the polymeric formula for the everyone, but when we can see there is a GI disturbance or the GI problem, then only we can go to switch off to the their oligomeric formula or the monomeric formula, because the difference between the polymeric formula, there the normal carbohydrates would be there, the protein would be there, and the long chain triglyceride would be there, but the difference of the monomeric formula, that easily digestible. They're using the peptide based and the amino acid base, but the protein already pre-digested. So pre-digested formula should be there, but again on top of we can get the electrolytes also, the other nutrients also, the micronutrients also, that has to be taken care of, because if you go for less of micronutrients, that could be again a problem for a malnourished patient.
Absolutely, because blood workups, depending on that, we need to choose the products.
Yes.
Now, Vijaya, my third question is, how do you modify your protein intake for ICU patient with AKI versus those who are already diagnosed with CKD to balance the nitrogen loss and development of uremic complications? Like